Hello everybody, I am Dr. Xiao Yiling from the ClearSK group of laser clinics. Today I'll be sharing about acne scars and what are the modalities of treatments available to treat it. As we know, in Singapore, we are in a tropical climate. As a result, acne scars are very common amongst us. And in Singapore, there are two main groups of treatments that are very useful in handling acne scarring. Firstly, is fractional lasers. Next is RF Microneedling. Fractional laser works by targeting the epidermis and the dermis of the skin. We created thousands of deep but narrow treatment zones into the skin through the laser beams. These zones are called MTZ or microthermal zones. These microthermal treatment zones are where collagen will reproduce. By increasing the collagen and elastin in the skin, we can improve the acne scars, pores, fine lines and wrinkles in the skin. Next, I'll talk about RF microneedle, which is Sylfirm X machine. Traditional microneedling uses thousands of needles to penetrate into the skin, causing micro damage to the epidermis of the skin. RF or radiofrequency, as we know, is well documented to stimulate collagen production by causing controlled injury to the skin at a temperature of 40 to 60 degrees Celsius. So at this temperature, collagen fibers are produced, and so it can be used to treat acne scars, wrinkles, skin sagging, etc. By combining RF and microneedling, they will produce 8 to 10 times much more collagen than just either of them alone. And also, repeated ultra-short pulses will not cause a lot of damage to the tissues, but instead will stimulate a lot of collagen growth, and it's much shorter downtime, and it's much more comfortable. Similar to fractional lasers, Sylfirm X functions like a microcomputer in which the doctor can adjust the depth, the modality, as well as the duration of each pulse of radio frequency. Therefore, the results can be adjusted to have different outcomes. For instance, it can be used to treat scars, pores, wrinkles and fine lines, deep lifting, and at a different wavelength called the pulsed wave, it can be used to target microcapillaries to treat conditions such as rosacea, post-inflammatory erythema, as well as melasma. Comparing fractional lasers like Fraxel, Pico lasers, Mosaic, Pixel, as well as RF microneedle like Sylfirm X. So lasers are generally much more superficial. It will not exceed more than 2 mm depth of penetration, whereas a microneedle can go up all the way to 4 mm in depth. Therefore, fractional lasers can be used to treat mainly the more superficial scars, whereas Sylfirm X is targeted at the deeper scarring such as peter scars, rolling scars. Effectiveness-wise, fractional lasers uses only laser energy to stimulate collagen, whereas Sylfirm X uses microneedling as well as RF energy to give double the results. Fractional lasers does not have needles, so Sylfirm X has microneedles. But however, the needles are so fine that it is almost negligible in terms of pain. Some tips about Sylfirm X. Firstly, pre-procedural preparations. Numbing cream will be applied to the skin to reduce the discomfort. However, most of them find it very comfortable and comparable to normal fractional lasers treatments. Next, aftercare. It is important to apply post-treatment creams that consist of antiseptic and then followed by using sunblock to protect the skin against ultraviolet. So for the next 7 days, no sunbathing or swimming is allowed because after all there are wounds on the face. Use only gentle cleanser and moisturizing lotions on your skin for the first 1 to 2 weeks after Sylfirm X. Typically, the redness doesn't last longer than 2 days, so most people find it suitable for an active working life. It is recommended to do at least 4 to 6 sessions of Sylfirm X at the interval of 4 weeks. Most people will report at least 30% improvement after 3 sessions of treatment. Of course, if you are younger, have better skin and more moisturized skin, you will see results even faster.